the technique is now that we ultrasound guided actually is finding the lesion, and when we have found the lesion through a small incision in the skin, then we can guide our needle into position, open it to 2 centimeter first, heat a little bit, go to 3, go to 4, go to 5, and then heating step by step until we have reached 7 centimeter, if we desire to do a 7 centimeter lesion. Here we have the right hepatic vein, and by this rather long procedure we will have here, access point is deep. Then on the other hand we will avoid a lot of structures and we have a very good vision about what we're doing. So I think I will select this approach. Then I'm preparing it with a small incision when I'm using the ultrasound as a guideline. And then we will approach. Then I'm placing the needle in the incision. And if the incision is too small, because the needle needs to pass the skin without any obstructions, and I just do it a little larger. And then we are approaching. Then we go to the center of the process, and then we take it a little bit backwards. Then we need to start. What we have seen is that we have opened the RF needle to 2 centimeters, and then I will ask our nurse to start the procedure on the blue button. Then the procedure is started, and we have started heating. We can also see the ultrasound image. When I'm moving the probe, I have hooked the whole metastasis, which is harder than the surrounding liver. So you can see the soft liver is actually moving up and down around this hard nodule, which has been speared by these tines here. So it looks good, and it's in a good position. The temperature is correct, and we will approach. Temperature has been reached, and then go to 4 centimeter, and again we see that we can move it. If you look at the ultrasound image, you can also see some white lines, and that is actually vascular structures with a lot of air bubbles, because we are frying or boiling some part of the liver, so small bubbles will be created and disappear throughout the vascular system. You can see it being drained into the right liver vein. You can also see the more we are treating on the ultrasound image, you can see the more blurred it's getting. So it's very, very essential to use the ultrasound for a precise positioning of the needle in the start of the procedure. You cannot correct it with same accuracy during the procedure as you can place it correctly in the start of the procedure.